The producers of this presentation would like to thank all of the people who appear in this videotape. These people have graciously consented to speak about their experiences, including some very personal issues relating to prostate cancer. Their courage is an inspiration to all who watch this presentation, as well as prostate cancer survivors worldwide.
I literally agonized over what to do about my prostate cancer. I mean, I had friends who had had it. They said, cut it out, just cut it out. And my doctor said, radiation. And you're a layman, you don't know who's right. Doctors will tell you this is the only way to treat this thing, but it's not the only way. There is no one only way. There are a number of options available to most people. And you should know, though I wanted to know those options. I wanted to know, what the potential effects of each type of treatment would be, what I would have to endure, and so forth. And I think everyone should have, anyone who has an option should know what the option is.
I was very disappointed. It was quite a shock because I was hoping, obviously, that this was not really cancer. And but then I faced up to it, and I decided to attack it very vigorously and not to wait 2 or 3 years for something else to happen. I decided to get something done about it, either radical prostatectomy or the cryosurgery. One or the other, I felt had to be done within the next 6 months, because once the cancer had gone beyond the prostate gland, then it becomes almost inoperable.
Well, it was a little bit of a surprise, but to find out that I had cancer in the prostate, but I knew it was probably fairly small and fairly limited, I thought at the time, and I thought, well, if I have it, I'll just get it fixed. I like to get things fixed when I find out about things. So I said, well, let's go ahead and do what we have to do.
Well, was I fearful for my life? I don't think that's really what I was thinking. From what I've been told and read about prostate cancer, it's a slow-growing cancer. And I guess there are some physicians that would tell you, don't worry about it, you'll die from something else before you ever die from prostate cancer. I chose not to believe that.
I was very happy to find out that there was something other than the radical prostatectomy that gave me a chance to be cured. That's cryosurgery. I felt good about that.
Currently, almost 200,000 men will be diagnosed with prostate cancer in the United States this year, and it is currently the leading cause of cancer in adult males today. The majority of men with prostate cancer are in their 50s and 60s. It's rare to see prostate cancer before that time, and it is recommended that men get a yearly PSA screening starting at the age of 50. However, if men are at increased risk for prostate cancer, if they have a family history, or if they're African American men, we recommend that patients be screened earlier, starting at the age of 40.
It's really interesting that even though prostate cancer is one of the most common cancers in men, we really haven't heard much about it until recently. I think a lot of that has to do with that men, as patients, are very reluctant to talk about their medical problems, especially when it relates to prostate cancer. What's been really nice about the increase in awareness is that it enables us to reach these patients who normally may not be screened for prostate cancer, and we don't see them until much later when our treatment options are a lot less.
Well, my feelings about having been told it was cancer was, let's get rid of it. Well, now, what are my options? And those were explained to me. Do nothing, radiation, cryosurgery, or the other alternative at the time was the radical prostatectomy.
We have treatment options available. And then the next step then is to go over these treatment options, risks and complications, and how they as a patient fits in to the different options available, and go over what the choices are potentially best for them.
The first reaction that I had when we found out about it was fear for his life. You know, what can we do to stop this right now and not let it get beyond where it is? What can we do? Then came the second part of it, how shall we take care of it? And I was so supportive of him when he decided to go with the cryo.
When he first heard he had cancer of the prostate, he really thoroughly looked into all options. I went with him. We went to a university hospital where they gave us a complete rundown on the major surgery angle. We also went to another university hospital where they gave us a rundown on X-ray and proton therapy. And I kind of, not being a doctor myself, I couldn't make the decision, but I certainly felt I had to back him up. He did a lot of research on it, and I wanted to be behind him on whatever he chose.
The thing about prostate cancer is that once you get prostate cancer and you don't treat it, that ends. All that comes to an end pretty quickly. So that's why I decided to have it treated very fast.
Well, when a biopsy is made and it confirms the diagnosis of prostate cancer, I have a thorough discussion with the patient in my office regarding the next step and the management of his disease. Usually the next step would be to determine whether or not the cancer in the prostate has spread. And prostate cancer usually spreads to the lymph nodes or the bone. So we would order a CAT scan of the abdomen and pelvis and a bone scan.
I was looking for a cure. You know, I'd go on hormones if I had to. I'd do just about anything. But I was looking for a cure, and I never felt that a radical prostatectomy or a salvage prostatectomy was something that was for me. So I met with this doctor's associate and spoke to him, was encouraged by what he told me.
If a patient has prostate cancer that we think is confined to the prostate gland and has not spread, there are several therapeutic options which can cure his disease. There is the surgical removal of the gland, known as radical prostatectomy. There is radiation to the prostate, and now in the United States we can deliver the radiation in one of two ways, either externally, where a patient goes to a radiation center every day for about 40 days, and also something known as brachytherapy, where radioactive seeds are placed into the prostate gland. The newest therapy is known as cryosurgery, which is the administration of a very cold substance into the gland, which can freeze the prostate gland and kill the entire prostate as well as the cancer.
Once I've reviewed the treatment options with the patient, I will go over basically the risks and complications of each of the therapies and whether or not their pathology, the amount of cancer they have or the small amount, is a good fit for the treatment modality. I also look at what are the goals for the patients for the treatment options as far as risk and complications. And that's very crucial for a lot of patients.
He showed me literature on the subject. I was able to bring that literature home and read it. I didn't have to make up my mind at that particular moment when he first told me about it all. In fact, I think it was probably 2 weeks later before I went back to him and I said, you know, let's do it. And we set up an appointment with the hospital, and bam, bam, away we went.
And after leaving his office, I began an investigation. And I think I spoke to a total of 5 cryosurgeons over the country. Sent faxes to them, asked questions, did some more reading. And I guess about perhaps 3 weeks or a month after I had my initial contact with the cryosurgeon here in New York City, I called and I made an appointment to meet with him again and told him that I had decided to go forward with cryosurgery.
And then they will ask me, well, if it were you, if it were your father, what would you choose and why? And it really boils down, from my perspective, is what are the risks and complications. And in our hands, cryosurgery seems to have the fewest complications, as incontinence and risk of blood transfusion. It's not a major operation, and we can bounce back sooner. However, we do say that the downside is potency. However, as most of their spouses feel, and as even I personally feel, is that, you know, we really want to try and get rid of the cancer, and that's our goal. And if we can minimize the severe side effects, which are really incontinence, then we can live with the other problems. And usually that's why most of the patients will end up choosing cryosurgery.
I took a look at radiation therapy, which was proton beam, which incidentally is followed by external irradiation or routine or the regular radiation. They do them both when they do the proton beam. Their results were good that they reported, but I did not want to have radiation because in my own practice, I've seen too many complications from radiation. And I've also heard and read that there are recurrences after radiation. Of course, there's recurrences after all kinds of treatment, but I just did not want to have radiation because of my experience, past experience with the radiation. So it was narrowed down to cryotherapy versus major surgery, and I felt that the cryo, and in view of the stage of my disease and the fact that I did not have any evidence of it having spread, that cryosurgery would be better for me and just as effective.
After doing my investigation, I felt that the only options I had for a cure, which is what I was looking for, were either a salvage prostatectomy, which I had determined was potentially too debilitating, and I wasn't, happy with, the prospect of having that done and what might, happen to me, or cryosurgery. And the cure was the first reason I opted, the potential for cure, and the second was that it was a minimally invasive procedure, as far as I knew. So I went with cryosurgery.
One of the main reasons he chose cryo was because of the much easier recovery time. He was only going to be in the hospital overnight, and he would be ambulatory immediately following the procedure.